Hey everybody, I'm David Rapaport. I'm a board certified plastic surgeon here in New York with 30 years experience and also the founder and medical director of Aethos. What we're going to do now is talk about your upcoming wedding. Today's Friday. This week alone, I saw 3 women who are getting married next year. So it's a real thing. You got engaged, congratulations. And now you're thinking, holy crap, I'm getting married in a year and a half, which is the typical women from this week. What do I do? You might have some things on your mind. All 3 of the women I saw this week came mainly seeking improved definition between the face and the neck, which is a very hot thing these days. Your beautiful face looks best when it's on its own and not blended in with your neck. Okay, so that's one of the things. But what we want to do in this video is really spend some time unpacking the timeline of how to prepare for your wedding, and also, what kind of treatments you do and how you would do them. And I like to say, just like pretty much everybody that's going to get married has a rehearsal, to some extent you need to have a rehearsal in terms of some of these treatments. You don't want to just have something, you don't want to have Botox the first time 2 weeks before your wedding. And we'll unpack that and help you understand treatment by treatment, if you've never had them before, when it makes sense to start and why. So that's one of our goals. And then hopefully we'll also talk a little bit about family, because most people that are getting married, most women that are getting married are going to have a mother, if God has been kind, and we'll have a mother-in-law as well, whether God is kind or not. So those are also people in or coming into your lives who may want some attention, who are older than you. So we'll try to talk a little bit about that as well. So hopefully all this will all be educational and have a real purpose in terms of helping you plan the steps that will lead up to an amazing wedding. It goes without saying that the photos of your wedding are photos that are going to stay in your family for generations, and they do have some, major values. So it does make sense to do a little bit of preparation, also from an aesthetic point of view, if that's important to you. So when it comes to details before your wedding, a good general way to start looking at things is to separate your face, which is really your face and neck, and your body. And out of respect to the face, let's start with the face. I think with both face and body, the best time to start this planning would be a year before. If you have more time, that's great. But a year before is a very appropriate time. At Aethos, you can come and sit down with one of our aesthetic consultants as well as with one of our estheticians, who are all excellent. And, and when you're out, you can express your concerns. What are your insecurities? What are the things that kind of bother you that you want to improve, and create a strategic plan. So let's do that a little bit when we talk about the face. When it comes to skin color, tone, texture, and in that I'm including acne, which is an interesting thing to talk about, I have a couple points to make. We have, as I mentioned, wonderful 3 full-time estheticians that are all great, and each has their own personality, but they're all terrific. Remember, chances are for your wedding, you're going to be wearing full-on makeup. So really, when it comes to things like a pigment irregularity or pores or, little red blood vessels and all that stuff, there's kind of 2 levels that you're working on. You're working on how I feel about myself in the mirror, and I'm about to be married, and you may want to address all those things. But on the one hand, especially if you're on a budget and stuff, you're going to be wearing makeup. So, if you have more vascular stuff, doing that laser on your face to get rid of those blood vessels is great, but because you're wearing makeup, it might not be that crucial to your wedding and to the photos and to all that stuff. So that I'm putting out there as an aside. I think every bride is going to be a little bit different. When it comes to the dynamics, right, the movements of your face, then obviously the first possible, and not necessary, but on some people it's a good idea, intervention is Botox. And when I say Botox, I don't mean brand name Botox. It can be, but there are all kinds of botulinum toxin, and actually there are some specific ones that have better features than the brand name Botox. But regardless, you need to understand, it's not a black-white thing, meaning it's not like I get Botox or I don't get Botox. So your forehead is one of the key areas, and this is what you need to understand. You need to get the treatment that works for you, that you're happy with. For most women, freezing your forehead's a bad idea because it's going to make your brows feel and potentially look heavier, and you'll show no expression whatsoever. Now, hey, to each his own. That's great for some people, and maybe some weddings you don't want to show it, but most people want to show expression. They just don't want to have, crazy ass lines and want to maybe, do a little lift on the side more, things like that. So Botox can be used to help contour the forehead and the eyebrows, but you need the rehearsal, right? Botox typically is a 3-month thing, meaning it's gone by 3 months in most people. And you need to know what treatment you like. So if you started a year before, you've got more than one treatment able to do it. You don't have to keep doing it if you don't want to. But it gives you plenty of time to get to the aesthetic that you're like, I like this. And then you know. So you've got your provider and you've got the dosage set up. Now, one of the things I can show off about Aethos, we don't just write a note that says 20 units. We make marks on your face to show where we're putting the product so we can be as precise as possible. And that works both ways. If you love what you got, we can repeat it because we have exact photography. And if there's a problem with what you got, because it's too much, too little, we can also see what we did and how do we tweak it more precisely. That's very valuable. So Botox typically might treat this angry muscle. This is called the corrugator. The forehead we were just talking about, the crow's feet. And again, even crow's feet. You don't want to have the squinty stuff. You don't want to have the lines maybe. And I would say, honestly, 90% of women that get crow's feet are happy and do it again. But 10% of people say, my smile's funny. I didn't really like it. So it's another reason why you're not doing this 2 months before your wedding. You're doing it happily a year before. You're doing it at some point before that whatever you look like from this, if you don't love your smile, nothing devastating is going to happen. Meaning you're also not going to get Botox for the first time in your life 2 weeks before your engagement party or whatever the hell it is, because you want to control the situation. Okay, so I hope we've made Botox clear. Let's go down to filler. The most simple filler, the most common filler for young women is lip filler, which everybody hearing that might be rolling their eyes thinking, oh my God, what a disaster. Because you see the disasters, you don't see the good stuff. The good stuff just blends in. And the truth is, if your lips are flat, you smile, you have kind of a flat upper lip, filler, sometimes lip flip gets involved, that's a Botox thing, but filler can be amazing. But again, when I do, there might be one woman I do a syringe on and she really wants more, and another woman you do half a syringe and it's like, that was too much. So you really, again, have to rehearse it and see how you like it. The other thing about lips is that of all fillers, unfortunately, when you fill the lips, because they're red, they're full of blood, they're moving all the time, it doesn't last that long. So lip filler typically on many, many, many women is kind of gone by 3 months, whereas most filler is 9 months, a year. Lip filler not. However, there are some people that will get lip filler once, and their lips will always be a little bit enhanced forever because it induced some collagen. So again, start early, see what you like, understand that a day or two after almost anybody gets lip filler, it's going to look a bit more than you wanted, and you go from there. You see what it's like at a week, do you like it, see what it's like at a month, and that way you can know, this is how long before my wedding I want to get my lip filler. This is how long lip filler lasts on me. So you can kind of plan out that stuff. When it comes to other filler in the face to increase things like proportionality, again, you have a weak chin. You're going to get some chin filler to enhance it, pull it forward. Just like everything else I'm talking about, you want to get the look that you like without being under stress, anxiety, pressure. Oh my God, it's wrong, it's right. Let's go 2 days before. You don't want to live that nightmare. You want to do everything well enough before. If you got chin filler or other mid-face filler, jawline filler, all those kind of things in about a year, you'd probably be repeating it 3 months before, more or less, because it might be fading and you want to touch it up, or you might be touching it up earlier. But the point is, again, it gives you time and it puts you in control of what's going on. So being deliberate, planning it out, and giving it time is key, as we've discussed, for Botox, for filler. When it comes to facial contouring, all in all, like what I saw this week, 3 women coming saying, I don't like this. This isn't cool. I don't like my profile, too fat. So again, you might go down 2 different courses, and we'll talk about more of this on the body, but because it relates to fat removal, right? You could do the surgical route, which is the most precise and, predictable custom sculpting. Typically, liposuction under the chin is 3 tiny pokes. It's a minimally invasive procedure done under local anesthesia. We're talking a 1-hour situation here, and we're talking a bandage that's sort of a little compression thing for 48 hours. Then you're good to go. Not painful afterwards. You can be at the gym 2 days later. You can drink 2 days later, and you will probably be totally fine at work 2 days later, because at most you might have a couple little hickeys down here. So at this season, just a collar, a little scarf or something. In the summer, you might have a couple hickeys, and you'll need to deal with it. So that's if you're doing lipo. Any surgery that you're doing, a good rule of thumb is to understand that your final result typically is 3 months after, okay? Whether it's liposuction of this, whether it's breast implants, even if it's a facelift for your mother or mother-in-law. The typical done result, what you see is what you get, is at 3 months. It's not a week later. There are certain kinds of facelifts that look horrendous 3 weeks later, so you need to know what you're getting into. My facelift looks pretty damn good at 3 weeks, but it ain't over, and you want to have much more than that for something like your own wedding. So we got to get into the weeds on that. Now, if you want to do this totally non-invasively, if minimally invasive procedure of liposuction is too scary for you, then you might be doing something like CoolSculpting, which is totally non-invasive. It's a little applicator that freezes this little pocket. You can, if you have a big enough space here, you can have 3, one that freezes here, and then one that freezes here, and one that freezes in the middle. Each treatment's 45 minutes. You do them all on the same day. But it takes 3 months to see the final results. Like at a month, you'll see most of it, and you might be doing it 3 times. So again, if you want to really improve your contour before your wedding and not do a procedure like a little lipo, best to even start, at least a year before. Because if you do CoolSculpting today, you can do it again in 6 weeks and again in 6 weeks. So 6 times 3 is 18 weeks. So you're about 4 months out. So now you're just over 6 months from your wedding, and it's still okay to get lipo. So that works. But you can't start CoolSculpting 3 months before your wedding because you have no plan B. You can finish 3 rounds of CoolSculpting, but if you didn't respond the way you hoped, then you're stuck. You want to do these treatments that depend on your biologic response, such as CoolSculpting. You know how sensitive is your fat to cold? Because that's how CoolSculpting works on the fact that fat cells are more sensitive to cold than other cells. This is a fact. This works. But you know what a bell curve is, right? In science, like the average has this response. The people on the right will have a more severe response. It'll be like, whoa, like lipo, amazing. 1 treatment, I'm done. But the people on the left of the bell curve will have very little response. So they might be stubbornly going through 3 sessions, and at the end they come out and say, I don't really see much difference. I think I should do the lipo. So you need to have time for that. At Aethos, the money you paid for the CoolSculpting will typically come off of the lipo. So we've got you covered. We're not just a bunch of people trying to get your money. We're trying to get you through your journey in the best way possible, and we're on your side. So hopefully that helped you in terms of understanding the timeline for different facial treatments. A couple of fringe treatments. Your dad, let's say he's like me. I've had hair transplants about 10 years ago. Due for another, because I've lost more of my own hair that wasn't transplanted. But the point is this. Your dad, your mom, somebody wants hair transplant. It's a year before you really see the result. Basically, you move hair from areas that are not prone to balding to areas that are prone. They go into shock. They fall out after 2-3 weeks. They don't start growing back till 3-4 months. They're really starting to grow at 6 months, 8 months, then they gotta grow, right? They don't suddenly become 3 inches long. So you're really talking a year before you're probably looking in the mirror and seeing the beautiful hair results. So keep that in mind. I had a man last year who came in 3 months before his kid's wedding hoping to get hair transplantation, and that wasn't gonna work. You have to understand the natural sequence. By the way, the expert who treated me is the expert that would treat you, and if it's your mom or you, eyebrows are a real thing, especially with older women. And there's hair transplantation for eyebrow reconstruction is absolutely amazing. Tony does an amazing job taking some of the finer hairs from lower down in the back of the head. And again, yes, you're going to have to trim your eyebrows more because it's going to grow like the hair in the back of your head, but you're going to have eyebrows. It's not going to have to be penciled in. So again, that's the kind of thing that needs time. You want to do it about preferably a year before. So I hope this has been helpful. Next step, we're going to talk a little bit more about the body, and let's see if you know what part of the body, based on research, is the part that most brides are not so happy with before their weddings. So the answer to the quiz, it's actually the arms. Why? Because so many women I think most wedding dresses have arms exposed, and really, what are you seeing at a woman's wedding typically if you're not wearing a short dress? You're seeing the face, you're seeing the neck, you're seeing some décolleté, and you're seeing those arms. You know, you're not gonna have an open back unless you like your back. But you might feel like you need to show your arms even if you're not in love with your arms. So the arms is the number one, and by the way, tummy is number two. So let's talk a little bit about what our approach is if indeed you say, I don't like my arms, I need help with the contour of my arms before my wedding. So this is another case where you don't have to come a year before, but a year before is really smart. Now, when you're coming for an arm consult, you're going to be faced with, generally, right, because I don't know your arms, and maybe your arms don't have excess fat, but if they have excess fat, we're also going to assess how much laxity there is now, kind of hanging skin, is there any? Is that hanging skin caused by the fat, so when we reduce the fat it'll hang less? Or is the hanging skin sort of despite the fat, meaning you had more and now you have less and it's all hanging? That's probably more like your mother, but maybe you lost a lot of weight and that's you. So again, diagnosis is key, meaning fat versus laxity. There's the laxity now, and there's the term I use, the impending laxity. Like, let's say your arms are just a little more round than you want, they bulge a little bit. I'm pinching and it's fat, it's not muscle. So we can make that better. Lipo's the best way. It's, again, a 1 hour procedure under local anesthesia if you're only doing your arms. It's literally that easy. You're awake. We can give you medicines to make you comfortable, which almost everybody gets, but you're breathing on your own and talking and feeling good. The moments of discomfort are brief, and the medicines, you don't usually even remember with the oral medicines. If you want to be sure you don't remember, you get an IV, but it's really overkill for most people. But anyway, we look at that, and if the fatty excess and impending laxity are an issue, then lipo is quite possibly the best choice for you. As well as possibly trifecta type treatment, internal tightening, skin tightening. That's for mild laxity. If your mom, whoever it is, has severe laxity, the sooner you understand what's going on, and if it really is just hanging loose skin, minimally invasive treatments won't help, and lipo only makes it worse because you're taking out whatever stuffing there is. So only a brachioplasty will take care of severe laxity, and that's a big scar, and I have people that do that. I don't want to do that operation anymore in my career. I've not had problems with it, but I do what I choose to do. It's not on my repertoire. I have the privilege of making the dishes that I love to serve and stuff, and lipo is, facelift is, breasts are, brachioplasty and thigh lifts are not. But anyway, you might be a person that maybe it's not biased, maybe it's just your own decisions, maybe you have such beautiful and the skin you don't even want to violate with a tiny scar is like that light Latin, Asian, whatever you want to call it, cafe au lait, not ultra dark and not ultra light, and no blemishes and no moles and no nothing, and it's perfectly smooth. So you don't really like to violate that with anything. Just to be clear, the lipo scar is a little scar in a crease where your arm meets your body. So when you're standing, nobody sees it if you're standing with your arm down, but when you reach up for a few months, it looks kind of like a dark stain. And then on most people after a few months, it's just a very fine line that you don't really recognize. But that's different on that person that doesn't have a freckle, doesn't have a mole. So again, everybody is different. Everybody has different concerns. And there's nothing wrong with you coming with the approach that says, if I can make my arms slimmer and tighter without anybody poking a needle or giving me any tiny scar, I respect that. So that means you're heading towards CoolSculpting. CoolSculpting is done in cycles or rounds, meaning you put one or two serial applicators and then you wait at least a month, sometimes 2 to 3, before you treat again. Usually in 6 weeks you treat again. But you're doing it probably 3 times to get the maximum and the most balanced, and touching up the result one after the next, right? So it's a lot of time. And you can't guarantee anybody, even though we have experience with thousands and thousands of CoolSculptings, you can never guarantee a result, because it's not like lipo where you control the fat that you remove. Here you're relying on how sensitive your fat cells are to the cold, because that's how CoolSculpting works, by essentially freezing them. And on average, about 25% of the fat cells that are grabbed will freeze. But by the way, when you go back, it's not going to be another 25%. People aren't honest with you. It's going to be a little bit more. Why? Because what that applicator is grabbing is a lot of sort of the part of the tree that's already been picked, if that makes sense. And maybe it has a few more apples in there, a few more fat cells, but it has to still grab the same skin and still grab the same area that the sensitive fat cells already died there. You see what I'm saying? So treatment 2 and treatment 3 aren't exponentially increasing you, they're tweaking you. So my point is, after 3 CoolSculptings, it's entirely possible you'll say, talk to me more about the lipo thing. At Aethos, we got you covered, because a lot of, if not all, of what you pay for CoolSculpting might come off your lipo fee. And again, we have exact policies, and you'll know going in what our policy is. It has to do with what areas you're treating and all that kind of stuff. So we've got you covered, but that's why it's good to start early. And the same thing applies for tummies and bodies. It's all based on your anatomy, and it is very possible. And one thing that might be in your mind, is it possible to do lipo of this fat and the arms at once under local? For the overwhelming majority of bodies and personalities, the answer is yes. But it needs a consultation. I do want everyone to understand that although consultations with me cost money, it applies to your procedure. But aside from my consultations, I want to strongly encourage you, super strongly encourage you, to take advantage of complimentary consultations, which we offer. We have aesthetic consultants who I have trained, and I review these things. So when you go in, I really suggest you say, I appreciate everything you're saying. Please get back to me if Dr. Rapaport has something more to say after he reviews this consult. Okay? And we'll get back to you. So I hope this has been helpful. I hope and I'm assured that this is only a small part of what's going on in you preparing for your wedding. We have not touched on, and we will touch on, weight loss. That's obviously a big topic. Another thing to talk about that's kind of obvious as you plan for your wedding is the whole issue of people want to lose weight, particularly brides. A study in psychology today actually shows that 90% of women in America during the 5-6 months before their wedding are actively engaging in some form of real dieting. Another study by Cornell shows that 70% of women want to lose weight before their wedding. Here's what I have to say about it. There are much better tools today to help you lose weight than the diet pills from days ago. And of course, I'm referring to what we call the GLP-1s, Ozempic, Wegovy, all those guys. We're not going to go into the details of them, but this is a service we provide. It is something you can get in a lot of outlets. But here's the thing that you need to realize, that the study in psychology today to talk about 5-6 months before, I would humbly suggest that you also move that to 12 months before. And here's why. When you're losing weight, and this would apply to GLP-1s like Ozempic or anything else, any other way you lose weight, you don't eat grapefruits, who knows what you do. You're not just losing fat, okay? Your studies show that you're losing about roughly 30%, 15 to 40%, around 30% of the weight you lose is actually muscle mass. Now, that should matter to you in terms of fitness, and means that when you're losing weight, you really need to pay more attention to your muscles. Specifically before your wedding, though, that applies on the face. It can make your face look leaner and increase your desire for things like filler. And the arms. So when you're losing weight what I want you to understand is two kind of unintended things happen. You're losing muscle mass, which is why Pure Impact, which is the muscle stimulation we offer, you might find helpful to supplement your own weight training, especially for arms. A good-looking arm is toned. It's not just lean, okay? So keep that in mind. And then the other thing that we've talked about and can't help talk about is the laxity. If you go by what women have been doing in the past and start that dieting at 6 months, it's going to be a month before when you say, holy shit, I'm thinner, but I don't like the laxity I'm seeing. So SoftWave, 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 and move everything back to a year. So you're hopefully getting near that ideal weight at 6 months, not because you're Superman, but because you got to see what it's doing to you otherwise to control the laxity that's made worse, to improve it with on the face that may well be filler, may very well be SoftWave on the face, on the arms, wherever it's appropriate. I hope this is helpful. I think the more you know, the more empowered you are, and the timing of these things does matter. Before we leave the face, there's one treatment that in the last 2 years, I would say, has become really at the top of the list in terms of demand, and similarly very appropriate before a wedding. I'd say on women that are certainly late 20s, 30s, it starts to become an issue. What am I talking? I'm talking about treating laxity, right? I'm 66, a lot of laxity. Filler too. But the point is, you're a little loose. SoftWave is a revolutionary treatment in its simplicity. What do I mean by that? In our practice, it has mostly replaced Morpheus. You've heard of that more because it's been around longer. But Morpheus involves needles and energy. And the needles might go 4 millimeters deep, which is where your fat is. And heat, just like I was talking about CoolSculpting, you might be very sensitive to cold and lose a lot of fat. Well, your fat cells might be very sensitive to heat. And a little bit of heat that'll tighten one woman might dissolve fat in another woman. And if you dissolve fat under the skin, what have you done? You've increased laxity. You've made the problem worse. You don't want to unstuff the pillow, right? Getting filler, like on my 66-year-old face, helped put a little stuffing in. But I've also had 2 SoftWave treatments. And what that is ultrasound that goes into the skin only 1.5 millimeters deep. And that's the elegant beauty of it. It won't kill your fat. It will, by and large, increase the thickness of your dermis, which tightens your skin. One thing we do that's special at Aethos is we actually measure the thickness of your dermis in every area we're treating. And then we'll measure it again when you're 2-3 months out, and we want to see that it's gotten thicker. If it has, then we have good reason to recommend that you do another treatment. If it hasn't, we really should go back to the drawing board and see what other options there are. Maybe sculpture, maybe something else. So SoftWave's big. It's big for brides in the 30s plus, and it's big for brides' moms, and it's even big for some brides' dads, for people that don't want to get facelifts but want a little tightening. It both does tightening. It's FDA cleared for lifting of eyebrows. It also is good for crepiness. And I'm going to get treated again for this crepiness that I have when I swallow or move my neck, because nobody loves crepey skin. So that's another thing I wanted to mention before we leave the face. It is also very relevant actually on the body as well, and we'll talk about that too. But tightening is big to all of us, especially as more and more of us slim down. And what's a huge thing that, I don't know, 90% of women do before their wedding? They lose weight. Well, when you lose weight, laxity gets worse. So again, SoftWave's a big thing, and something we can talk about more in person. Why might you want Botox? And when I say Botox, please understand I'm referring to botulinum toxins. There are about 5 of them, I think, in the US right now, not particularly brand name, because they're much more similar than different, subject of other videos. But here's what you need to know about why Botox might be desirable. So what Botox does, what botulinum toxin does, very simple. It relaxes muscles. It can paralyze a muscle, and people also use the word freeze because paralysis sounds scary. But when I'm doing this, okay, making this angry look, what's going on is there's a little muscle that looks like a belt called the corrugator, and it contracts. So when that belt contracts, it shortens, and that creates these lines, okay? In another video, I discuss why right now. I'm due for a little bit of Botox, but I'm complicated because my brow's low. You'll hear more and learn more. But the point is, Botox relaxes these muscles, okay? You probably, no, I don't want to say probably, but many people who, let's say, have hyperactivity, or, you know, your fiance, your mom or mother, like, why are you angry? Why are you upset? And you're not upset. You're just looking at things, and you look at things that way. Well, that's the kind of person that likes getting that area treated. And by the way, there's even research that shows that getting Botox here for depressed people can actually help with depression, because when you look less angry, you come across better to people and they respond better to you. My father, who was a Holocaust survivor, who had depression for a variety of reasons, even when he was depressed and I was in Australia and it was tough for him, would sign his letter with a little smile. And he always told me, just smile. And it's really true. So using Botox kind of relates to that a little when it comes to the anger. If I look less angry, people receive me better. So I'm digressing, which I tend to do, but it's to help you understand why this, you know, is a popular thing and might make sense. Now, the forehead is more complicated, and that's what really needs rehearsal. On me, this is all complicated because of my droopy brow. But the forehead, you see, it's not just a matter of lines. These lines are what you pay to lift your eyebrows. So, you know, I have one person who's my partner's best friend, and she comes in like clockwork, and she looks damn good with a completely frozen forehead, meaning it doesn't move at all, and she loves it that way, and I have no complaints. You know, nature put her eyebrows in a good place. Other people would go crazy because they just want to be able to animate. They don't want to look frozen, right? So the key thing with forehead is to understand that the look in your forehead, whether you're frozen, whether you're slightly relaxed, whether the sides go up more, whether you look like an ad for Adidas because you have 3 stripes here and nothing in the middle, that's my biggest disturbance against Botox. When I see that, it's the most negative advertising, because nature doesn't make Adidas ads like that. So anyway, my point is, you need to have a provider that will communicate with you about, well, first of all, that helps diagnose and, you know, maybe to help you understand where your brows are, if they're low, if they're asymmetric, to help learn what's important to you. And then based on what look you think you want, to deliver the treatment, remembering that 2 units here and 2 units here doesn't do the same response on 2 faces that look the same, okay? It's really important. That's why don't get Botox 2 weeks before your wedding for the first time. Not a smart move. So by starting this like a year ahead, you have tons of time, and you get the treatment. At Aethos, my policy is within a month of the treatment, any touch-ups are free. But you can't take botulinum toxin away. So if you got more than you wanted, you're gonna have to live with it. And that's a case where you might be unhappy that it lasts a long time on you. So I start with a shorter acting form, and most of them are shorter acting, like Dysport, brand name Botox. Latibo now is nearly identical to Dysport as far as I can tell. Xeomin, you probably need to use a higher dose, but identical. Then there's this stuff called Daxify, and there's some other things coming out that on most people may last a bit longer. So I recommend that everybody try that at some point once they're at the dose they like. But until we get to the look you like, we use the regular stuff, and we want to know we have enough time. And again, at Aethos, me and my nurses all mark you precisely. We don't just write a note saying we injected you with 50 units or 10 units or 12. We mark where we're going. And did I mention we use a vein finder before, so that to lower the risk of accidentally hitting a vein and giving a little bruise. So I hope I made it clear about Botox. And by the way, another area for Botox is this. You don't want to look squinty. Also, if you're going to be working on any kind of natural tan, you know, you end up with the squint mark. So 90% of people that get Botox to this muscle, called the orbicularis oculus muscle, 90% of people, I'd say, like it and get hooked. You know, they keep doing it. 10% of people feel that it affects their smile in a way that they don't feel is authentic. So that's just another reason. Get it well enough before so you can decide what you like. The doctor, even if they could read your mind, can't always predict how that filler is going to work on your lips. That's just the truth. Anyone that tells you otherwise is bullshitting you, you know, to try to use their authority to make you buy stuff. The only way to know how your lips do with lip filler is to try lip filler. And to understand you're probably going to look swollen for a couple of days, and to understand that most people, it's kind of gone in 3 months, 4 months. We say 3 to 6. More people 3 than 6. But guess what? There's a real percentage of people, and I've been doing this long enough and researching it long enough, that you do filler once and there's an effect that lingers. It seems to be permanent, meaning it triggers, and we're talking about hyaluronic acid filler. We're not talking about other stuff, which I warn you against as much as possible, and I'll get back to it. But I'm talking about regular filler, hyaluronic acid. My favorite is Kiss. RHA3 is another product that was just published in an article showing some possible advantages. So we'll be using some of that also and see how our patients feel. Some patients like Restylane. It's a more defined look. People that want real border definition. I do Restylane on the borders. I feel it's, because it's firmer, it attracts less water than Kiss, so it's less of a puffy look. So anyway, it's all about what you want. And again, we communicate. I know what I have in my drawer, right? What peppers I can use. So I'm picking my kind of pepper for your dish based on what you want. Maybe you've had dishes before, right? I'm essentially that kind of a chef. But I'm an honest chef, and I know that the analogy I say is it's figure out how much salt to put in your chicken soup. So you put a little, see how it is, then you come back, maybe you need more next time, et cetera, et cetera. So with lips, it's the same deal. It's great that filler's reversible, but you'll see how you feel, and maybe you'll do it once a year before, and you'll be one of those lucky people, and you're gonna say even 3 months before, my lips, I love it. Well, if you did it a year ago, and 3 months, meaning 9 months later, you love your lip, you don't need more filler, but you're in a minority if you're that lucky. Chances are in 3 months, won't be there anymore, or feel nearly gone, just like most botulinum toxin is, by the way. Gone at 3 months for most people. You'll find out, and then you can make your schedule. So I think I'm hopefully helping you make sense of this. Other treatments like, skin care, hydrofacials, the more you do that, the more you help your skin, the better. I love SoftWave. I'm 66. I've had filler. I've had SoftWave twice. It thickens my dermis, it helps tighten me, give me a better shape, better contour. I think it's a great thing, probably maybe more relevant to your parents, but maybe relevant to you if you're around 30 and you think you're loose, and don't let somebody talk you into a facelift. I mean, I've done facelifts on 35-year-olds, but there are very few people that's really the best thing for them. Our goal at Aethos is to help first diagnose you both physically, and then mentally is even harder, right? Like, what's your tolerance for downtime? What's your tolerance for discomfort? What's your tolerance for a bruise? Those are like the big things, right? How anxious are you? And all that kind of stuff. And so what can you handle? But that's the mental side. The physical side is what's best for you. When it comes to preparing in terms of the contour of your face, I strongly believe, whether you're a bride or anything, do the permanent stuff in general before you do the temporary stuff. So when you look at nearly any woman, front or profile, the more you have a bunch of stuff here, it doesn't look so nice. The face now isn't separated so nicely. There's a blending, there isn't a sharp jawline, there's a profile that you don't like, all that kind of stuff. So rather than spending $3,000 to $10,000 on jawline filler, which is easy to get to, really easy, on stuff that'll last a year, you could do a minimally invasive, less than 1 hour procedure that'll have you back at work and at the gym in 3 days that permanently improves your jawline by getting rid of the fat that's extra, if that's what you have, and that also tightens internally, so that, that's it, you're ahead. Add SoftWave to that. That's our new trifecta: Liposuction, internal tightening, and SoftWave for the skin. You're ahead. And then you can decide, let's say you did that a year before, which I've seen 3 women last week that are doing that over a year before their wedding. Then you have plenty of time to decide, yeah, I knew my chin was weak going in, this helped, I'm fine, leave me alone. Or, I trust the doctor, I like what he did, I think a little chin filler makes sense, let's do it. Does that make sense to you? That's what this is. You're on a journey that doesn't end with your wedding. It never really ends. And you want to find the right people who have a credo. We're named Aethos for a reason, because what I drill into everybody is you can't do a treatment without an honest diagnosis, right? I can't, so you have to diagnose the patient, and in aesthetics and many other fields, it starts with the physical, but converts to the mental, and the mental is a big part. I did secondary lipo on a woman I did 20 years ago or so. And what she needed, if this was a board test and all you saw was the photos, was a tummy tuck. She had a lot of loose skin. But that's not what she wanted. And she's autonomous. She's not my body, it's her body. And so we did secondary lipo, which makes her not look any better out of clothing, but guess what? That's not her focus. We discussed this. She knows a tummy tuck is what she needs if she wants to look better to a typical stranger or partner. She doesn't have that issue. She wants to just feel better in her clothes. Highly intelligent, highly successful woman. So that's what we did. But if there wasn't the proper communication, all it would be is just, you need a tummy tuck. And if you don't want that, get lost. Not okay. Wrong advice for this patient. So that's what Aethos is about, and being able to accompany you on your journey, because it might start with a little Botox, a little filler. It might move to a tiny procedure, which people have a lot of bias about a lot of things, right? New mayor in New York is a socialist, so we turn him into a communist, and we use our biases. I'm not saying one thing or another. I didn't vote for him, by the way, but that's not the point. The point is bias fucks us up. Anywhere we apply bias where we shouldn't be having bias, it fucks us up. And it can fuck us up on treatment plans when we're biased against lipo. And I'm sorry, it's not the same thing as racism, but people think a lot of things about lipo that are just pure bullshit. They're myths. Like it hurts a lot, like it's dangerous, like you have a lot of downtime. It depends what lipo, it depends what doctor, it depends what patient. And I love lipo more than any procedure because it is the safest procedure. Never ever had a major complication from lipo, ever, okay? And I've done thousands on over 30 years. And it's another point, but I think that's maybe more of a good indication than 500 5-star reviews that are all written the last 2 years. Little common sense, but anyway. That's how I look at our relationship. I'm passionate about being honest and passionate about mutual honesty and learning about you so that we can, and being honest with you about expectations so that you can make the right choices and move on. I hope this all makes sense. Thanks.